Good evening, everybody. I am Dr. M Patil from Ashira Hospital. Today, I am going to speak on topic role of antiplatelets plus statins in secondary prevention. Focus on atorvastatin and clopidogrel. Statins are the mainstay in the secondary prevention of atherosclerotic cardiovascular diseases in survivors of myocardial infarction and stroke. Statins compared with placebo reduce the rates of recurrent coronary heart disease and the need for revascularization process. American Heart Association, American College of Cardiology guidelines recommended for patients with ASCVD or other very high risk conditions, high intensity of statin is prescribed to achieve a 50% reduction in LDL-C and, if possible, in LDL-C less than 55% milligrams per deciliter. Atorvastatin has been extensively studied in the primary and secondary prevention of cardiovascular events and may have some clinical advantages over various other statins in these respects. The ideal American incremental decrease in endpoint through aggressive lipid lowering, that is ideal, and TNT, that's treating of new targets trials demonstrate the preventive efficacy of atorvastatin in patients with stable coronary heart disease. In addition of antiplatelet therapy to statins is a globally recommended clinical practice to reduce risk of cardiovascular events. Current US and European guidelines recommended DAPT in patients with acute coronary syndrome, with clopidogrel being an essential part of this regimen. Compared to aspirin, this 150 milligrams per day, clopidogrel significantly reduces the risk of strokes, cardiovascular events, and intracranial hemorrhage outcomes. The host exam extended study showed that clopidogrel compared with aspirin was associated with lower rates of composite and clinical outcome in patients without clinical events for 12 to 16 months after percutaneous coronary intervention with drug-eluting stents. Statins significantly reduce mortality in patients receiving clopidogrel without affecting the platelet activation and aggression. It is thus a standard of care for secondary prevention of cardiovascular disease, that is myocardial infarction or stroke, in clinical use, a statin clopidogrel combination. Thank you.